Thank you for having us here, and thanks to Venkat and Ritu for inviting us to be here. It's such a wonderful forum. I should compliment for making this happen and taking this initiative in healthcare. A big compliment to that, and absolutely the need of the hour. And healthcare is going to change a lot. It's not going to be what it has been all throughout. It's going to change a lot. And the change makers, I can see this is the kind of forum which is going to change the healthcare for the better. And that's my strong belief. And we thought we'll make it cozy. I have Jasdeep with us, who has joined us about a month and a half ago, and with 25 years of experience running healthcare. So a lot of insights from practically how to run the show, along with the madness of the enterprise. Also, it requires a lot of professionalism to run the show. That's why we are going to spend the next 20, 25 minutes. We thought we are going to talk about what it is to do an enterprise and what are the challenges of today. And we'll also have a little time left for some Q&A. If you would like to probe us, we'll be more than happy, because sometimes we say what we want to say without knowing what you really want to hear. So I think the Q&A will be very helpful to round it up. Jasdeep?
Yeah, sure. Very interesting. In fact, when Dr. Sharan brought this up, saying this is an opportunity, invariably in hospitals, and all of you followed hospitals for many, many years, entrepreneurs are the ones who started private healthcare, backbone of where we are today. Any brand that you look at today has some doctor, some entrepreneur who started it and then migrated into making it more professionally run, getting in more equity, getting in more investments. So overall, we were talking, and I felt that, in India, no matter which brand you pick up, there is a face behind it, which makes it far more reliable, far more go-to brand, because there's a face behind it. Whether you look at SPARSH here, you look at Apollo, you look at Medanta, you look at any brand. Yeah, and that's when we started talking about whys, and me being me, I was asking him, why did you feel the need of getting a CEO? You were managing it, 9 hospitals now, big brand in Bangalore, second to Manipal. And there was, there are bigger visions, there are bigger dreams that he has, which I think requires some amount of sharing of responsibility, sharing of the dreams. And that's when we started talking about how each of us can actually bring it together and go forward. Yeah, so that's how this whole conversation started. In India, I think any business starts with somebody taking the risk. Yeah, somebody doing it, because nothing's served on the platter. You've got to find your way. You've got to go through all of that. And here we have somebody who spent 20 years doing this, and before that practicing as an orthopedic surgeon, which he continues to do even today. I think today morning he started at 6:30, did surgeries, and then landed up here to talk to all of us. But given all of that, there are multiple challenges which I think we'll talk through as much as we can, given the time.
Sure, yeah. So building an enterprise, why did I take it up, for example? So I'm sure there is no formula how these things happen. There are multiple routes in which this happens. I trained hard. I trained in India, abroad, stayed abroad, came back, and I was happily working as one of the consultants in one of the prestigious hospitals in Bangalore, 10 years of that. Obviously, when somebody wants to do this enterprise building, they have to be uncomfortable with the status quo. I think that's the primary thing where the bug bites you. You can keep complaining and spend the rest of your life doing the same job, or say, okay, let me see how I can do it better or do it differently, how I can quench my thirst of working in a better ecosystem. So I was doing a fairly good amount of work, but it was 1,500 square feet of an one department out of the many departments in one hospital, and I found myself not having enough elbow room to express and do things what you'd like to do. The science is progressing very, very rapidly, and the challenges of our ecosystem cannot go away. We can't wish them away. Ever since my medical school, there's one thing which has always bothered me, is we know that in our country, the best healthcare is not accessible to all. And it's accessible, the best of it is accessible to a very small number. At the same time, the science is changing and getting better by the month, by the year, and we are able to save so many more lives. We are able to live longer. The life expectancy has gone up. So I'll tell you a simple thing. In 1960s, a joint replacement, hip replacement was something which was invented. People who are crippled, and rheumatoid arthritis is a condition which was very, very rampant those days. In England, John Charnley came out with this hip replacement surgery, which changed their lives. They live on their own and they could become mobile, pain-free. It changed their lives completely. And that's an invention. So we are about 60 years since that happened. It is still not accessible to most people because they can't afford it. It gets better, smarter. So my dilemma has always been, should science stop getting better and serve whatever it has to everybody? Or everybody should be able to afford the great science? This dilemma, I'm not saying it's solved by a long distance, but this is one of the things which always put me at crossroads. I was in this corporate hospital. I could do wonderful surgeries, best equipment, best of everything, but I was available for a minuscule few. It's not available at scale. So I think my dream started with seeing how we can scale it and make it possible to have the best of science come to the more available to everybody. How we can democratize, that's the word which is being used. And I've been chasing that for the last 19 years now, building this enterprise. Of course, this was the purpose, but the route to there is not straightforward. It's very convoluted, and started working, started building. We have a foundation, we do a lot of charity for complexity and all of that, but even with all of that, it's still a very, very tiny contribution to what my dream was. I'm being very honest. For the first time, I think both can come together. And that possibility is only because of this ecosystem, the technology. The technology intersection can change this game. And I will tell you more elaborately why I believe that it can change this game. And how, and I keep saying this, 50 kilometers from Bangalore, you don't have the same healthcare what you get here. And this forget about the tier 2 cities and tier 3 and the Africas of the world. It's a far cry. If somebody is very smart, works very hard, can have a Merc. Somebody else who is not as hardworking can have a cycle. But when it comes to healthcare, the cycle wala really requires better healthcare than the Mercedes-Benz guy, because his health is his armamentarium to earn and live life. It's a total dichotomy here. It's a total contrast here. So I might sound very, what should I say? I might sound unreal, but I think it is possible. And when internet is available for everybody, when so many things have become so commoditized, healthcare is still in that echelon of only for a few, which is not fair. That's my view, Jasdeep. And
no, and you rightly said that this is the room, the technology piece of it, which will bridge the gap sooner or later. And for us, we are seeing that. In whichever brand you look at, there is a strong reliance on enhancing the reach. How do you get to the right set of people who understand where to go to, who to go to. And in big cities, our bigger challenge is that with so much of competition, healthcare becomes, how do you rank it? How do how do you get to the place where you need to? For example, if there is an orthopedic issue, how do you get a genuine feedback into the hospital or on the doctor? Is something which always remains a question mark, and that's why we live in communities. We hear positives and negatives of the same brand. Same person or two different people, same brand, having a very different experience. And no matter how much we work on standardizing SOPs and procedures and processes, at the end of the day, the clarity with which, or the level of communication that is open to the patient per se or the consumer, is what makes the difference. And you've seen it in your own practice. The follow through that you have of patients coming back to you, not just with themselves, with their families, etc., is primarily because they feel that there is going to be a level of transparency they can trust. In this room itself, we spent 10 minutes, and there were a couple of people who were saying somebody said, I'm moving because I went to you. Somebody said, I'm leaving because I went to you. These are very, very gratifying moments for this business. But at the end, on the other spectrum, there are people who haven't had such a great experience. And that's where I think technology can play a big role in getting the two ends meet. That's where I feel as a professional in the business, I'm desperate to showcase how our business is better or unique or something that is suitable to a certain category of people. But that genuinity is where we struggle. How do you get there?
Yeah, and coming back to how technology interface, I liked what Mr. Madan said. The 5 agendas what you set up are so appropriate, so apt. So now, how technology, how it can help medical science. And medical science is everyone's cup of tea. It's not away from anybody. All of us need it. Whether you're a doctor, you still need healthcare, absolutely. So in 2 ways is what I look at it. One is, how can technology help better experience, patient experience? Technology is also important to make healthcare more accessible. Healthcare as a better experience. Sometimes treatment is worse than the disease, and that's not what you want. And how technology can interface to decrease the waiting time, the need for traveling, the communication channels are so much open, and people who want to know more about their own health. In other words, how we can help every individual to be their own healthcare CEOs. That's what you want to do. Empower them. And the buzzwords these days are democratize them. And you can allow people or have people get the healthcare the way they need it. And I keep saying this, sometimes we, in our profession, we're sitting across the table and saying, this is what you need to do, this is surgery you need to undergo. The moment they say no, for some reason or the other, they can't follow your advice, and quite often you see the anguish with the professional. That's not what we are meant to be. Everybody is their own CEO. I keep saying we should be like Google Maps. If you say no and you take the right turn, it should still redirect you to where you're going. And that's the way the medical professionals have to look at it. But technology can be a great enabler to empower everybody. That is one role of technology. I'm sure many of the startups, what you're thinking of are along those lines. The second place where technology can be amazing is deeply into delivering healthcare. I'll tell you very simple things. I've migrated, now I do a lot of joint replacement surgeries. I used to do everything. These days I do joint replacement surgeries as my main thing. 30 years of experience to make least amount of mistakes and do a good job, right? My daughter is just qualified as an orthopedic surgeon. I dread to think that a lot of people will be subjected to her learning curve. Can you believe that? In medical science, there is a learning curve. For a surgeon, there is a learning curve. So somebody will suffer with less than perfect way of doing a surgical event. So, and this world has no time to have 30 years experience for all the doctors before they become, the need is massive. So how this can be transformed? We spoke about digitalization of healthcare. The digitalization of healthcare can give you so much of data. This morning we did a robotic surgery. How it works is you have the data of this. We did a hip replacement this morning. You have the data of the hip configuration, everything, before we start the surgery. And this is done a few days before. The planning is all done ahead of time. And we know what size, what we do, how we do, and all of that. And once we have all that data, the planning is done, and you go into the operation theater, and the robot executes the plan to perfection without a degree here or there, without a millimeter here or there. So now you can see what I'm saying. My daughter could do as good a surgery as me. In other words, all the surgeons who have got experience, we cannot rely on this word experience. We need to convert experience, or we have to digitalize experience. Once you digitalize experience, it becomes, you can multiply it unbelievably. You can reach so far and wide, and then it becomes predictable and the best possible outcomes for every patient, not just the lucky patient. And that's where this technology can take us. Make it more precise, make it more accurate, make it more wonderful. But having said all this, let me pull back for the last part of it. I want to ask Jasdeep, so while we as doctors are idealistic, we romance this whole thing, we think it's one of the most wonderful professions when you can take pain out of people. It is the most gratifying thing you do and all of that. But there are real challenges running a hospital or any enterprise, for example. So the challenges are having skills, abilities, having processes, protocols. While we think medical science is only about surgeries or diagnosing and treating, but there's a huge back-end operations. The supply chain has to work well. The finances have to work well. If Sundays hospitals don't work, but the banks don't give holiday for the interest they charge. So you have got multiple things to tackle with. So how do you see this ecosystem? How complex is this ecosystem?
And all I can say is thank God for that, because of which people like me have a job. Otherwise, doctors could have done everything. But on a serious note, I think it's huge. The way that a hospital operates today is no joke, because it's all about people's lives. While the doctor has all the great intentions, there are people who have nothing to do with with what the doctor is doing, yet a very important role in the patient's recovery, whether it's the housekeeping guy or whether it's the supply chain runner, for that matter, who has to pick up a medicine from the store and go and deliver it to the nursing station so that the nurse can administer. All of this makes into a very complex, very complicated environment which needs to be managed, which needs to be monitored. And over a period, I started my journey with Fortis Hospitals in 2002. In fact, before that at Manipal here in Bangalore. That day and today, huge amount of difference that technology has made. Inventors, people who are sitting here, which today we live as though it's part of our life. Just like what mobile phones were when we were in college, they were not there. But today you can't live without them. Same way, I think technology has become a part of hospital operations. It is something that we depend on. It's assumed that it will give us some pop-up, some alarms where something goes wrong. There is so much of reliance, so much of dependence on it, and it's growing. It is becoming bigger. Every day we meet people who've invented something which we need. And sometimes we as operators feel that this is how it will work. I met somebody who's into invoicing. Such a back-end operation. Which we make so many errors, because the churn today in India, I think every industry, specifically large workforce-based industry like hospitals, hotels, challenge is that you don't get people who are serious about a job which may not be most visible. People want to be visible, people want to keep making reels of what they do. Yeah, and sitting behind a desk and making bills is definitely not exciting for people. So we manage and we compromise with people who are not so well trained, and obviously a growing demand of handling volume. You don't necessarily get the most trained people. And that's where you make errors, and hence you keep looking for solutions which are agnostic of, people. We don't want only this guy can make great stuff and not that. Just like you can make the best tea for your spouse, nobody else can. Yeah, but that doesn't work in big operations. Yeah, so that's where I feel that it's coming together, but still a long way to go.
Yeah, yeah. So we often describe ourselves as we want to have the efficiency of a corporate, but the heart of a charity, and have the zeal of an education institution. And that's how we define SPARSH, because I think all three are important. It needs to be wholesome. We need to drive it in every way. It's an industry where you have to have as good rooms and services as a hotel, including the canteen. And plus, you need to have the empathy, what is required, and it's full of emotions. One thing is for sure, working in the hospital industry makes you better human beings. I can tell you that for sure. Now we open up for any questions if you have before we wind up. Yeah.
Obviously, the big elephant in the room, as they say, is the AI, right?
Yeah.
Everybody's talking about AI.
Yeah.
And, obviously, it's overhyped or underhyped, nobody knows. But that being said, I feel, I just read an article which said after 17 diagnoses, an individual, the doctor couldn't find what his problem was. Was it a heart problem? But AI could do it in first time, right? So I'm saying, where is this going, especially from an India perspective? Do you think AI will change the whole landscape?
I completely think so. So it never gets tired. It gets smarter with the day. It never gets old. It gets younger, so to say. So we have to embrace this. We have to work along with this. There is no doubt in my mind. For example, I told you about planning for a hip replacement surgery this morning. Right now, I am doing the planning. The data collected over the last 1,000 hips I have done is available. And like this, many surgeons like me across the globe, that data is available. Now you say, this is the anatomy, this is the configuration, this was the solution. Now put all of them together, you have a fantastic algorithm. After some time, you don't need me. It needs a CT scan to do the images. The algorithms are derived. The planning is done. The execution can be done by a technician. That's when the healthcare can reach the world. You cannot reach the world. We cannot scale. It should become like an assembly line. The problems are plenty. And if it becomes an assembly line, that's when it becomes cheaper. When we hero worship and think he's the most artist, biggest artist, I did MF Hussain for every painting, is a tough one. And AI is a great hope for this. That's why I think accessibility and affordability with the best of the science coming together will happen with technology. I have been telling my colleagues, guys, if doctors and hospitals don't back up, you guys will take over the healthcare industry, which is the truth, Sorry, go on.
My question is just the yang side of what his thought process is. Like I strongly believe in this yin and yang philosophy, right? So while AI is also powerful and strong, I just read an article shared by Dr. V. Mohan, where people are kind of self-diagnosing themselves using AI and are hurting themselves really badly, right? In some cases, even terminal kind of cases, right? So how does the hospital industry should educate general audience or general people about the potential downsides of over-reliance on AI? Of course, they will, go under the hype, try all kinds of things, but the right usage, the right boundaries needs to be set on where it is good and where it is not so good.
Yeah, so another analogy, all of us, I'm assuming, are parents, no matter how much you tell your child, don't do this, they will still do it. So same is applicable to the world at large. People do want to make their own diagnosis and try things out. And I also wanted to compliment, with what Dr. Sharan said, that it's the coming together. I don't think it can pass on to AI completely and it can remain with the clinicians completely. It's the marrying of two at the same at some common level is what will benefit everybody to a greater extent. And robotic surgery is a biggest example of that. While we assume that robo does everything, it's not so. It helps in planning, it helps in execution, but underlying comment is it helps. It's still done by the skilled surgeon. It's still done by people who are aware of the anatomy and also what could go wrong. Yeah, so I don't think any of the extreme will work.
I completely agree with Jasdeep, but what makes you think doctors don't make errors? It is, if you look, we don't have statistics, but if you look at American statistics, it is the second largest anything we do, there are complications, infection, this can go wrong, that can go wrong. The second largest complication is iatrogenic, that is man-made, okay? So we can have regulation on that, we can have authenticity signed off on that, but it has to be available. Doctors and the profession, we ourselves are the biggest deterrents for technology to come in. So that's the battle I fight with my colleagues all the time. I mean, we just want to be very special. We just want to be the people. You have to come to me to get a solution. And that slowly will melt away. And AIs can be regulated. It can go overboard for sure. But how we regulate things in every walk of life, there could be some regulation. There has to be some amount of filtering of the things. And end of the day, how do we do medical school? I study everything. There's a process of elimination is how we diagnose a problem. So it could be this, it could be this, it could be this, differential diagnosis. Do this test, so we rule out this and finally say this is what it is. And this is not beyond the comprehension of AI. I mean, of course, like Venkat said, it's overhyped, oversold. I'm sitting on the chair here, we say, because of AI, I'm sitting here. That's going overboard. That's how loosely it is used. But anything will attain refinement, regulation. And when it gets better, smarter, I'll tell you one simple thing. A guy met me who works for Association of Osteosynthesis. He said, give me 6 months with you. I'll sit with you in the outpatients. How many patients you see, how many possible diagnoses you give, how many possible investigations you ask for, how many treatments options you will tell. So you allow me to sit 6 months with you, I'll produce a 95% of Sharan Patil, which may be pretty good for most of the villages of the world. So it's okay. So I think we need to embrace this. My view is we need to embrace this, work with it. All the more responsibility on us to refine it and make it proper and not allow it to go wrong, not allow it to go loose. That's how I would look at it.
Yeah, good morning, sir. You talked about empathy and emotions,
Yes.
which is the limitations of AI and computation and automation. So my question is, I'm doing some research on that, trying to build a self-awareness model and which will be catering to put more emotions into AI. So what will be the quantifiable measures or parameters as a doctor you feel we should focus on while building empathetic and emotional models?
Yeah, no, I can tell you this. Nurses' jobs are going to be more valuable than doctor jobs in the future. They are the people who can sit with you and talk with you and empathize with the patient and the problems. But I use ChatGPT a lot these days. I'm hooked to it. I'm really hooked to it. And whatever, I'm coming to your point. Perplexity, so this ChatGPT talks more sweetly to me than my wife, actually. So if I say, please, can you give me a structure to my thoughts? It says, great idea. Let's sit down. End of the day, it is the conversation, the language, what matters. Empathy is always about the language. And perception, how you understand it. Your understanding and the language and communication, what makes the difference. I'm sure you'll figure out a very handsome or a pretty lady to do all these things for the patients who talk in the right tonality, language, and all of that. So I completely agree. End of the day, life is all about people. This world is all about people. And everything we do has to make people feel good, people feel better. And I have no doubt in my mind, all the technology in the world, everything means nothing. Everybody has born, everybody has to die. In between, there are a million emotions. And all these emotions, whichever helps us to augment this in a positive way, that's how technology has to be used.
So I have found if you put emotional questions to them, it will give wrong answers.
Right.
I can show you. And all chat GPTs, like all the 5 chat GPTs, Grok, your Gemini, everything I have put.
Don't put emotional questions. Ask real questions, it will tell you emotional.
Because
Okay, we'll take one last question. I couldn't deny. I know there's so much
Yeah.
of energy on your rising hands. Oh, somebody else took the mic? Oh.
Yeah. So I think my question is around machines taking over, like surgery example that you gave. Let's say 30 years from now, there's going to be a difference between a doctor who has done the same surgery manually versus someone who has done only with robots. So what happens to the skills of the doctor? And like, what if we land in a situation where the doctor has to do it manually, who has never done it? So how does that evolve? I'm in favor of machines taking over. I'm an engineer, makes me feel proud. But then, yeah, what happens to?
No, it's a great question. So what machines are going to do is make human beings more consistent, more precise. That's what they're going to do. Ultimately, what is to be done is your thought process. That will execute you exactly what you want to do. That's the role of machines. This is what we said about a million things. If we didn't carry water from the well in a faraway place, and if the tap comes to you, you'll become lazy. But it's part of the deal. It's part of the deal. Forget about doctors becoming jobless. What's more important is the world needs to be serviced. World needs to be taken care of. So that's the way I would look at it. But it's always going to be a slave of human mind. Human beings will be in control of situation, and training is a big aspect. We debate that a lot. Somebody who's training today straight away gets trained in robot and never in a conventional way of doing things. That's a big problem. What if technology fails? What is the backup? It is a problem. I agree with that. But there's a problem with every technology we use. We feel handicapped if our mobile phone is not there for 3 hours. You feel completely lost. You don't know. You don't remember any phone numbers, do you? You don't remember any phone numbers. You have to need that phone to recollect a number. It is a challenge, but we will navigate that. We will navigate that. There's a lot of simulation to be learned. There's a lot of execution to be learned. And then this whole thing will arrive at my whole idea is, can most people be served in a consistent manner with the best of medical science and technology across the globe? I'm not even looking at Karnataka, India. I'm looking at globally how we can serve them well, because that's the need.
Thank you. Thank you very much. It's very clear that Dr. Sharan has taken over the Health and Wellbeing Summit here. A big, big round of applause for both of them. I think we want you to stay. I think it's a perfect blend of a founder and CEO. We have a founder who's highly energetic. We have a CEO who's very calm, cool, and composed. A good blend. A big round of applause one more time for both of them.
That's a very quick diagnosis. No,
Well,
we wanted to talk to you about transitioning from founder to a professional. And I'm telling you, I mean, I've won many things. I want to win this one also. So I want to transition. It needs a lot of professionalism. We founders can be dreamers, can go haywire, can go all over. And these are the people who will hold the fort and tell you, don't be stupid, don't do this. And that's the balance you need. And I hope I have the wisdom to balance that. And I hope all the founders here know when to transition and when to do this. Thank you.
absolutely. We want both of you to stay. To all the audience who we couldn't take the questions, we deeply apologize, but we're sending Dr. Sharan back to the deck. I'm sure you can get in touch with him over the breaks time, and please get in. I would request our president, Mr. Madan, to kindly come in and present a small token of thank you for a brilliant session. One more time, ladies and gentlemen.
I am one maybe. And when we had them on the stage, in the interest of all the entrepreneurs as well, I think we'll now set the tone for the day, but there's an ask that I want from you guys. One of the things that we hear from our entrepreneurs is voices from the field and voices from the ground, especially as they're developing solutions. Many times I see entrepreneurs who have developed, but they have not stress tested that solutions by actually presenting it, which is what we're trying to do this evening. But if there's a way that we could work with you, without impinging on too much of time of the doctors, to really get voices of the pain points from the hospitals and present it to the entrepreneurs to say, hey, solve for this. I think that will really cut cycle times of...
Certainly, that's a great idea. Actually, we need to find solutions for real problems,
Exactly.
not imaginary problems.
Exactly.
Sometimes technology leads us to keep solving what is really not required.
And we will hallucinate as well.
Yes, yeah. So this afternoon, my Chief Technology Officer is
Right.
going to be here to listen to the people who have health tech
Yes.
products.
Yes.
And I know there are investors also around.
Yes.
So we would love to work in that ecosystem.
Fantastic.
Because we also need a place where we can all come together.
And test
And
things
we
out.
have already listed a whole lot of possible solutions for us. If you can pick them up and think if you can solution them,
Beautiful.
we'll be the most delighted.
Lovely. So we'll put some structure to that as we go along, but we'll take you up on this to really create problem statements that we can all solve for together.
How to fix everybody.
Thank you so much.